My name is Kate, and I'm a Girl Scout cadet. Today I'll be presenting my Girl Scout Silver Award project. Since the start of my own battle with Chiari Malformation, I found that very few people, including doctors, understand the condition and its impact on everyday life. People with Chiari are often believed to be faking symptoms to get attention, and due to the wide variety of symptoms they can experience, they often suffer for a long time before getting a diagnosis or proper care. My goal is to educate and increase awareness about Chiari malformation. I hope that this presentation will serve as a concise resource for people with Chiari to share with family, friends, teachers, or employers to help them better understand what they're going through. Let's begin. The objectives for today's presentation are to define Chiari malformation and its common symptoms, treatments, accommodations, and comorbidities. Chiari malformation is a rare and complicated condition. It is a structural defect where the brain tissue extends out of the skull and into the spinal canal, causing pressure on the brain and a blockage of cerebral spinal fluid. It is typically present at birth as a result of a misshapen or smaller than typical skull, or it can be acquired as a result of trauma or elevated pressure inside the skull. There are indications that some Chiari malformations are genetic, and research is underway to find the genetic link. Conquer Chiari, a nonprofit organization that funds research, education, and awareness about Chiari malformation, estimates that 1 in 1,000 people have symptomatic Chiari, which translates to 300,000 people in the U.S. alone. Chiari is a serious neurological condition that can have a severe impact on patients and their families. Research has shown these to be the most common symptoms for adults with Chiari: headache, pain, insomnia, numbness, neck pain, fatigue, dizziness, weakness, balance problems, and shoulder pain. The list of the top 10 symptoms for children is slightly different, with vision issues, cognitive issues, and sensitivity to noise replacing insomnia, numbness, and shoulder pain. There are many other symptoms people may experience. Due to the variability in symptoms and fluctuation in symptom severity, people with Chiari may appear normal one day and be bedridden the next. The majority of people with Chiari malformation are asymptomatic and do not warrant any intervention. In people with mild symptoms that are manageable, symptomatic treatment should be used. In those with significant symptoms or syrinx, surgical treatment is usually recommended. Surgery involves removing a piece of the skull and some of the spine to give more room for the brain to restore cerebral spinal fluid flow. On more severe cases, the outer covering of the brain is removed and expanded with a dural patch, and occasionally the surgeon will cauterize parts of the cerebellum, which causes it to shrink. Many people require repeat surgeries due to complications with bony regrowth and scar tissue. Surgery for Chiari malformation is not curative, but rather a way to decrease progression in neurological symptoms and prevent long-term damage that can occur from the constant pressure on the brain over time. Chiari comes with a lot of symptoms and a lot of related conditions. People with Chiari may need to use some of these accommodations to help them function. Physical rest, adaptive equipment including a cane, wheelchair, walker, etc., glasses or other accommodations for visual deficits, a cervical collar, a scoliosis brace, orthopedic splints or braces, noise control, and pain medications. Chiari is often accompanied by a number of different conditions. A large survey of adults with Chiari identified the most common comorbidities as you see here on this slide. Scoliosis was the most common condition, followed closely by fibromyalgia and syringomyelia. I'll go into more detail on these conditions in the next few slides. Scoliosis is an abnormal lateral curvature of the spine. It's most often diagnosed in childhood or early adolescence. It is generally not noticeable to the naked eye till the curves get to a moderate to severe range. Mild to moderate curves are often managed by physical therapy and orthopedic bracing. More severe curves require surgical correction. In people with Chiari, scoliosis is usually an indicator of a syrinx, and mild to moderate curves usually respond to a Chiari decompression surgery. Syringomyelia is a disorder in which a fluid-filled cyst called a syrinx forms within the spinal cord as a result of a blockage of cerebrospinal fluid. Over time, the syrinx can get bigger and can damage the spinal cord and compress and injure the nerve fibers that carry information to and from the brain. Symptoms can include nerve pain, muscle weakness or paralysis, loss of reflexes, loss of sensitivity to pain and temperature, and headaches. Syringomyelia is often an indicator that surgical repair of Chiari malformation is needed. After successful surgery, the flow of cerebrospinal fluid is restored, and the syrinx usually shrinks. Cervical instability occurs when the ligaments between your spine and skull are loose. These lax ligaments allow for excessive movement in the top two cervical vertebrae, which may result in symptoms such as headaches, fainting, or even memory loss. Abnormal range of motion in your neck area can trigger cervical instability. Ligament laxity may be caused by genetic connective tissue disorders such as Ehlers-Danlos syndrome or Marfan syndrome. Symptoms can include muscle spasms, neck, shoulder, or jaw pain, difficulty swallowing, tenderness at the base of the skull, light sensitivity, and the feeling of the skull may fall off the spine. People with craniocervical instability will often wear a cervical collar for symptom management and may need surgery to feed their skull to their spine. Ehlers-Danlos syndromes, or EDS, are a group of rare inherited conditions that affect connective tissue. The different types of EDS are caused by faults in certain genes that make connective tissue weaker. There is no specific treatment for EDS, but it's possible to manage many of the symptoms with support and advice. Symptoms can include an increase of joint movement or joint hypermobility, stretchy skin or fragile skin that breaks or bruises easily. People with Chiari malformation are generally advised to be tested for EDS before surgery, as it can impact their recovery and increase risk of complications. Intracranial hypertension is a buildup of pressure around the brain. Symptoms can include a constant throbbing headache, which may be worse in the morning or when coughing or straining. It may improve when standing up. Temporary loss of vision. This can be triggered by coughing, sneezing, or bending down. Nausea, feeling sleepy, or feeling irritable. Treatment for intracranial hypertension involves placing a shunt in the brain to divert fluid out of the head. If you are interested in learning more about these conditions, here are some additional resources where you can further research Chiari. Thank you so much for listening. I hope you learned more about Chiari malformation and its related conditions.